Our topic is patient-provider conflict, which is when there is a lack of communication between the patient and provider. This can cause misunderstanding, trust loss between the patient and provider, the patient being unhappy with the treatment, not following doctor's orders, or the patient even terminating the treatment altogether.
Oh. Hi, how are you? I'm okay.
What's going on, Stephanie?
My knee hurts.
Your knee hurts? Okay, let's take a look at it.
Ow! Ouch!
Oh, okay. Well, Stephanie, from the examination, I can tell you that there's infusion and starts of osteoarthritis.
What's osteoarthritis?
Mom, will you be quiet? I'm trying to listen to what she's saying.
Like I was saying, the pain is due to the infusion and osteoarthritis occurring in your knee.
So what does this mean? Can you explain it better? You do know my mom has hearing loss and she's got a hearing aid.
Well, why didn't you have that noted in the chart?
It's right there.
What's infusion?
Well, if you stop interrupting me, I can explain this to you.
No, I don't need you to explain nothing to me.
Stephanie,
Mom, where are you going?
Well,
Rude.
Stephanie, you're not going to find
I'll
someone
find
better
a
than
new
me.
doctor.
If you want to be like that, go ahead. Go ahead and see if you can find someone better than me.
Alright, what you just saw was patient-provider conflict. The patient was very unhappy with her treatment, so she decided to leave. This was all due to two reasons. The first reason being that the provider didn't even look at her chart before coming in, so she didn't even know she had a hearing loss, so she wasn't talking loud enough and you couldn't hear what they were saying, and then got into it with the daughter. And then the second would be that the doctor was using medical terminology instead of using basic language because they couldn't even understand what effusion or osteoarthritis was.
Hi, how are you?
Good, how are you?
Good, Steph. How are you doing this?
Good, you?
My knee hurts.
What's going on, Stephanie, with your knee?
When I walk.
She's having a lot of issues walking, going up and down stairs, just getting up from the chair.
Is this just new or has it been happening with you?
Happening for a little bit. Ow.
Okay, on a scale of 1 to 10, how bad is your pain, Stephanie?
About an 8.
About an 8? Okay.
Ouch.
And Jess, you said that this happened a couple of times. She's having a hard time walking and
Yeah,
stuff?
about the past week.
Okay, alright. So, well, Stephanie, from the examination that I just did, I can conclude that you have an infusion starting and it's a build-up in your left knee. And this is also could be a start of osteoarthritis.
What's osteoarthritis?
But what does this all mean?
Okay, so the infusion means that she has a fluid build up in the back of your knee, so that's where the pain is coming up. And osteoarthritis is due to her age, that her bones are disintegrating, and obviously wear and tear, they're tearing off now, so that's where all this pain is coming from. Oh, and it could be the torn meniscus also.
Torn meniscus? What's that?
A meniscus is what holds everything together in your leg, so it's basically a holding spot.
So what's the next step? What do we have to do next to get it better?
Well, we can start by injecting or draining out the fluid in the back of her knee.
No needles. I don't want needles.
Okay, that's fine. We can take a second option. Our second option is by taking some medication. Can you take some Aleve?
Yeah, we have some at home. I can make sure she takes it with medicine, with food.
Oh, perfect then. Okay, Stephanie, so you're going to take Aleve, and then I'm also going to set you up for an MRI. Is that okay?
Yes.
Okay, so how about I set you up for an MRI? Meanwhile, take some Aleve, and I'll see you back in 3 weeks for follow-up?
Okay,
Sure.
I'll make her appointment.
Sounds good. So,
Okay.
Stephanie, take care. And if there's anything else, please give me a call, okay?
Thank you, doctor.
Thank you.
Thank you.
Thank you, Jess.
Come on, Jess.
Proper communication between patient and provider. Provider use basic language to communicate with the patient and their family members. The provider took time to explain the diagnosis and explain the treatment plan with the patient and the provider. Also took the time to answer the question the patient or the family member may had.